just put on the regular little screen to and be okay. So.
Alrighty. And we are set in 5, 4, 3, 2, 1. Krystle, you're live.
Hello, everyone, and good evening. Thank you again for joining us for our second installment of the DHHS Health Equity Team COVID Virtual Town Hall Series. So this evening, we have a very special treat for you. We wanted to kind of shift the conversation a little bit and incorporate something that we all know that we need, which is a little bit of self-care. I do want to put a disclaimer out there. Most of what we're talking about, I need to hear myself. So this is part of the reason why I think this is a great conversation to have, because, you know, there are so many other individuals within our community that are neglecting our true self-care that we should be making sure that we're taking care of our bodies, our minds, everything across the board. So we have an amazing panel of experts and leaders here that we're going to just kind of have the conversation with. We'll keep it very informal because, as many know with me, I'm not really about going by the script. I want to just kind of present some questions and allow the panelists to let the conversation flow. And so we'll go ahead and get started. So I'll go ahead and start some of our introductions. All right, so Dr. Krystle Bowe is a family physician, a disability rights advocate, best-selling children's book author, and mother of 2. She completed her undergraduate studies at North Carolina A&T State University and received her doctorate of medicine from the Brady School of Medicine at East Carolina University. She went on to complete her family medicine residency at Vidant, am I saying it right? Vidant? Greenville. All right. After residency, Dr. Bowe began working as a primary care physician within the Clement Medical Group. Within her practice, she cares for individuals of all ages and also sees patients within a local skilled nursing facility. Her patient population is diverse and includes a large Spanish-speaking population as well, children and adults with developmental disabilities, and patients from a variety of cultural and socioeconomic backgrounds. Currently, in addition to a full patient panel and a busy outpatient practice, Dr. Bowe serves as a physician medical director within the primary care service line for Clement Medical Group and writes children's books. It is her belief that representation matters, whether it be in medicine or in literature. She strives to make sure that her children and patients live without limitations, and that is amazing. Have me all have a warm welcome in welcoming Dr. Krystle Bowe. All righty, thank you, Dr. Bowe. All right, next we have Elveria Hoke. She is a resident of Gaston County. Whoop, whoop, whoop. She's a proud graduate of Hunter Huss High School. Go Hunter Huss! And she's worked for Gaston County Schools for 13 years as a cafeteria assistant at Greer and Southwest Middle Schools. In 2018, she was hired as the very first community health worker for Contegra Health, formerly Gaston Family Health Services. And over her time, her title has changed to Community Resource Advocate. She is instrumental in the lives of patients, connecting them to much needed resources and helping them set goals to establish healthy eating and active living. Exactly what we need. She's an active member of the Highland Neighborhood Association within Gastonia, and she leads a community walking group and distributes fresh produce to patients and community residents. Elveria enjoys working alongside community residents to identify and bring solutions to the inequities within the community, preventing both residents and patients from living healthier lives. Out of all of her accomplishments, she is most proud of being a mother of 2 wonderful children, her son Tavion and daughter Giselia. Am I saying it right? If not, please correct me. Just Shayla. That's so beautiful. All right, everyone, help me in welcoming Alveria to the panel today. Thank you so much for joining us. All right, Miss Lisa Clement-Bryant. This is a quote. I just love this quote. I have to say this off the gate, guys. So she is a woman passionate about family, friends, and the health of the world. She is the director of employer services at Clement Health. And as an experienced professional with over 25 years in the healthcare industry, Lisa grew up in Gaston County as well and considers this community hers. As a registered nurse who specializes in working with people interested in maintaining or restoring their health, Lisa has expertise in chronic conditions like diabetes. In her current role as the Director of Employer Services at Caramount Health, she leads a team of talented nurses, dietitians, and wellness specialists who deliver a myriad of well-being services to several companies within Gaston County, including the health department. Whoop, whoop. Outside of work, she is a wife and a mother of 5 adult children, but looks so great. I mean, come on. How is this even possible? Who spends most of her free time road cycling. We're going to talk about that later, Lisa. Sounds interesting. All right, everyone, help me in welcoming Lisa to the panel. Thank you so much. All right. All right, and last but not least, we have Judith Garcia. Judith Garcia is the Expanded Food and Nutrition Education Program Educator. You can say that all in one sentence, right? Of Gaston County. The EFNEP, which that is the acronym for, helps families and youth cook healthy meals at home, be more active, and save money on food costs, and as well as handle food safely. Judith has a strong passion for helping others and helping them to improve their quality of life. Everyone, help me in welcoming Judith to the panel. Thank you so much. Awesome, ladies. So again, as everyone can hear, a lot of the backgrounds with our panelists involving healthy eating, wellness, physical fitness, and just, one of the things we want to talk about as well is just the importance of having a primary care physician. We know that whenever it comes down to actually understanding your body, understanding your health and everything that comes with it, having a multitude of individuals that can help you with all of those factors are key. So I'm going to start off the very first question, and I will propose this to Dr. Bowe. So the very first question says, what would you say to someone who expresses fear in going to their annual exam? So such as, going to a specialist for your pap smears, mammogram, colonoscopy, prostate exams, and those follow-up appointments with their primary care physician or specialist because of the risk attached to being in a working environment that could be regularly exposed to the virus. So what would you say to someone who says, you know what, I know I need to get this mammogram, I know I might need to check on my prostate, I just turned 40, maybe I should get that exam, but I'm kind of afraid because, this is where, quote, the breeding ground, as they believe, of a lot of where COVID is. So what would you have to say to that, Dr. Bowe?
So I get to say this all the time. There's a couple of ways that I tackle this. At this point in time, I say, I completely understand your concerns. Let's get that vaccine. Let's get your vaccine. And as soon as you're vaccinated, you can rejoin the world. Not only can you get your health needs met, you could go out to eat. You could go to the park. You might even be able to take a trip this summer. Vacation could happen for you. When we're talking about self-care, get your vaccine. That is a great answer. When we get to the talk about the vaccine, we go into that and I explain the science behind it because most people who understand the science behind the vaccination process then agree to get vaccinated. I've had to tell other people, unfortunately, cancers are still happening. Heart attacks are still happening. And I've unfortunately had patients die of things that were not COVID. And as I am very committed to all live patients, I have to take care of them on all their health needs. I am not about to have these patients survive COVID and then die of something preventable. What we have learned this year is that your health matters and we have got to take it seriously. I also say to them, for my patients, I tell them all the things we're doing within the clinic. We were not allowing individuals to come in as visitors with patients. We screen patients, pretty vigorously. And anybody who has a fever, cough, nausea, diarrhea gets a telemed visit, meaning you don't get to come into the office. And if I think you have COVID, we don't test you here either. There is a third-party testing site to get this done. And so for any of the doctors that you see, if you're worried, ask them, what precautions are you taking to protect patients against COVID? But most importantly, at this point, if you are worried, get your vaccine. Because if you're worried about going to the doctor's office, you should also be worried about going to the grocery store, to your child's school, to work, to church. Protect yourself in all areas, not just at the doctor's office. You're probably safer with us because more of us are vaccinated than anybody else. We're also better versed in hand hygiene, social distancing, wearing our masks properly, meaning covering our nose and chin. And so you're probably safer with us, but I want you safe everywhere.
Awesome. Thank you. I totally agree. I want to propose the same question to Lisa as well. What would you say?
You know, we are now more than a year into COVID. And one of the things that my teams do is really kind of examine folks' adherence to, you know, taking care of themselves for different companies. And, you know, we talk about it nearly every day, the fact that people are behind. People, for good reason, in the beginning, when we didn't know as much about COVID and there were a lot of precautions, but, you know, all the different messaging around COVID really, you know, made people really fearful. But now we know more. I totally agree with Dr. Bowe. I tell people, look, I encourage them to seek care at their provider's office, at the hospital, at an urgent care. I said, because we know how to take care and prevent COVID. We know how to keep people safe. And I'll, you know, just underline about a million times, the same people who are worried about coming to do preventative care don't bat an eye to do other risky behaviors. And so, you know, sometimes when you're working with people and you have relationships established, you have to hold that mirror up to them to say, okay, you're okay with this, you're not okay with that. Let's talk about what can happen in a real way if you continue to ignore your health. And Dr. Bowe, I'm just like you. I know people who've, in fact, I just had a conversation with a friend of mine whose mom, she really forced the issue of getting her colonoscopy, and she's a couple of years behind. And she had a polyp that they're concerned about. And so, you know, that's frightening, you know, and again, I was like, well, thankfully she didn't wait any longer, but what if she had gone in even earlier? So, you know, real conversations have to be had with the people in our lives and our circles, professionally and personally.
Absolutely. Absolutely. I totally agree. I mean, one of the main conversations we've had, whether it's our epidemiology team at the health department or the community advisory COVID task force that we've talked about how, you know, a lot of the these underlying conditions such as diabetes, such as, you know, the work that you've done with so many individuals in the county with that has, you know, of course, further exacerbated their issues when they have COVID. It's brought them closer to death, if not death, unfortunately, because of the fact that they had this underlying condition. And I think that was one thing that, to be quite honest, in the African American community, from, you know, individuals I was speaking to, I don't know if they were just really connecting the dots early on. Think about it, let's fast forward back, or rewind back, should I say, back to you know, about a year ago. Think about it. A lot of us, we really weren't aware a lot of what we're aware of now. And I feel like I found so many people, whether it's family and friends, with these underlying conditions like diabetes and high blood pressure and these COPD. I mean, some of my mom's friends have COPD and all these other things, and they were just not thinking it was going to hit them as hard as it has. And thankfully, a lot of them survived, but a lot of them did not. And I think one of the main things that we're seeing now with the younger generation not really wanting to be on board too, I mean, a lot of them also have some of those underlying conditions. It's not just about those who are over 65, you know, you could be 25 and have an underlying condition and still have that same risk there. So I'm so glad you guys did speak to that. All right, so our next question is, there have been a number of different barriers encountered with COVID. An example of one of these obstacles includes the capacity and operating hours restricted to gyms and fitness centers. What innovative alternatives can those within the community participate in that will encompass a variety of different fitness activities for multiple abilities? So I'm going to kind of just pose this question to everyone because I feel like all of you guys could speak to that. So I'll just open the floor for you guys.
So I'd love to start because I'm talking to patients about this every day. One of my patients rightly said they had gained the COVID-19. And many of us have gained weight during this pandemic. I was on my way. I had gained a quick 10 pounds once the gym had closed, and it was rough. And so without the gyms, without your regular activities, it's been really hard. I've been recommending to patients walking outside, just going outside. If you've got a neighborhood you can go in, walking on a local track, doing exercise videos on YouTube. I had a patient who introduced me to track cardio, and she's been doing these exercises and they're amazing. If you have a treadmill at home, using that and timing yourself and saying, I'm going to get on it each day. If you're going to get an exercise bike, that's another way that's easy on your knees. There are some foldable exercise bikes. I use Amazon for everything, and I got an exercise bike off of Amazon. You can do virtual classes. I know some of our local gyms are doing virtual classes and they're good. I recently got sucked into the cult of Peloton. And so now I'm doing those Peloton classes and I'm on that treadmill. But anything that connects you to other people and keeps you active is good. Small things do just as much as big things as long as you're doing it every day. Even if you're just dancing in the house with your kids or running around the house with the kids on your back for 15 minutes a day, or say doing crunches with the kids hanging on your legs. Anything that's getting your heart rate up for a period of time, I'd recommend that you do. And you find something you like and you just stick with it. For those people who've gotten vaccinated again, you could look at returning to the gym again with the vaccine. You can look at going to the gym. You can ask your gyms, just like you ask your doctor's offices, what safety protocols are you putting in place to feel comfortable going? I know the Y is telling people you've got to schedule when you can come in to keep too many people going in. You could do pool activities and outdoor pool activities, which we know are safer and reducing the transmission of COVID. So any of these things would be fun and easy to get you more active.
Awesome.
I know one of the things that was really jarring for people, and I think that has Krystle sort of alluded to that, and Dr. Bowe, you too, we like full stop. We just got so many things pulled out from under us. And like you said, I had somebody to tell me today, and it was funny to listen to her say it. She said, I really felt, my husband and I felt like we were like, it was a snow day. So, when COVID first came, we didn't really know what was going on. We were pushed away from work and places were closed. We went to the grocery store. We bought everything that we had. She said, and like we ate and ate and ate and ate. And then next thing you knew, it was 3 months later. And we're still eating and eating, 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 because they had, they lost some habits and gained some new ones. So the fact that the rug was sort of pulled out from under us, a lot of people hadn't gotten back on track from that. But Dr. Bowe is right. I have through COVID, if there's anything positive to come out of it, for me at least, has met this reconnection to nature. I never really have been an outside girl, but because all the indoor spaces were off limits, like you said, walk. You could walk with somebody at a distance at that point, or walk with we started doing family, just let's get out of the house. Let's, after dinner, let's all go for a walk. Like we hadn't done that in years. That was wonderful and amazing. I think about the parks that we have here in Gaston County. So many of the county parks have the actual machines. Now, granted, you need to use your safety protocol. Like I'm the queen of, let me carry my wipes. Y'all see them in the background. So, carry your cleaning materials, wipe those things down. You could, they have the rowing machines and the little step-in things. I know at Lineberger Park, they have that. There's a lot of that available right here in our communities. But, I think folks just have to reorient themselves, right? We can no longer, it's a year. We can no longer say, I've gained weight because I've gone to the gym. I get that in the first 3 months maybe, but now what's the plan now? Because people say the COVID-19, but the information that I saw from the news last week was that on average, it's closer to 20, and for men closer to 40. So, on average, the 40%, almost 50% of Americans have gained significant weight. And this is going to be a lot harder to get this off, and how that impacts chronic condition management. And again, if you're not going to see your doctor, you're gaining weight, what trajectory are you on, right?
Absolutely, absolutely. Judith or Elveria, did you want to speak to that as well?
So this was kind of going off learning new habits with gyms closing. I kind of took a different route. I said, okay, I can control my eating. I'm still controlling what I put inside my body. I wasn't a great cook before COVID, but now I had a lot of time. A lot of restaurants were closed. So I started educating myself more on healthy recipes. I Googled healthy recipes with more vegetables. I am a vegetarian, so a lot of my proteins comes from plants. So I started looking at recipes and how can I incorporate this to meet my personal needs. So with that, I learned how to cook. And I do have to say, with YouTube, YouTube is amazing. I discovered HIIT workouts, which are high intensity interval training. I never did that in the gym because, it was overcrowded. You don't want to take up too much space. But with a video on the TV or on your computer, you just put a mat, you're there by yourself, put some music on, and just make an evening out of it.
I agree. I agree. I know since COVID, our working group kind of, well, we weren't able to meet like we normally did. But the amazing thing about it, we had some started their own community work walking group within where they live. So, yeah, they, maintain the distance, wore their mask and all that. But then I had some that started walking in the home. They tried to get, they had a Fitbit on, honey. These some faithful Fitbit wearers, making sure they get their 10,000 steps a day. I have one of the community members. She walked inside the house if we couldn't meet. Then we also have a cleanup, cleaning up the community. That's another exercise that you can have where, you still social distance and you can go around cleaning the community.
I love that suggestion. I mean, I feel like the older I get, I'm turning into the version I never of a woman I never thought I would be, the one who's concerned about littering and all this other stuff. I'm like, no, what are you doing? How can you throw something on the ground anytime I'm driving through a neighborhood? I'm like, why are we doing this? So I'm like the one person in my friend group that will yell at somebody if they think about littering. So just the fact that that you're right. Literally walk out your door and see how much trash you can pick up in an hour. I mean, how many calories would you probably burn? I mean, and then you're doing a great thing for the environment. I mean, and for the community. So I think that's an amazing, I didn't even think of that. Thank you, Alveria. Okay.
Let me add one thing. When Lisa talked about people kind of losing their bearing and treating this like a snow day, that was real. People were cooking more, but something people were also doing more across the country was drinking more alcohol. Alcohol consumption was up by some numbers over 150%. That alcohol has calories. It puts on some of those pounds. It also causes you to be more sluggish. It changes your sleep routine. And so when we talk about reorienting ourselves and getting back to those healthy behaviors and getting more active, for many of us, we talk about re-socializing children. We're going to have to get away from, we can't drink at lunch. You're leaving the house again. Like we've got to really slow that down. And so for folks who are looking at, man, I put on 20, 30 pounds. Are we having mimosas? Or are we increased our alcohol consumption? Because cutting that out or cutting it back will also help them cut those pounds down really quickly.
It's a really great point. That's awesome.
And let me just share a motto that kind of keeps me on track is I'd rather eat my calories and not drink my calories. So eat more whole foods, avoid those empty calories.
Amen. Amen, Judith. I totally agree with that too. Awesome. Okay, so next question. So Gaston County is one of many counties within the state that unfortunately has a high food insecurity rate. We know that the impact of COVID has had on the job market has in return led to a decrease in the amount of funds available for families to handle everyday expenses, such as purchasing food items and nutritional food items on top of that. What are a few affordable nutritional solutions that you may recommend to families who find this particular scenario an everyday reality? So I'll open this up to everyone as well.
So I can speak to that. In my FNEP series, we do have one of the lessons focuses on planning. And part of that planning process is looking at the store deals that you have going on each week. So kind of seeing what's on special, what coupons can you use. It does take a little bit of time, but if you're saving a couple of bucks, it really is worth it. Another thing, as a vegetarian, I don't eat meats at all. So a great protein source is beans. Those can come canned. And if you buy canned beans, make sure you rinse them to kind of get that sodium off. But if you buy dry beans, you cook them, they're very, they're packed with protein. A lot of frozen vegetables, they don't go bad. If you're worried about maybe, I bought this vegetable, but it's going to sit in the fridge, it's going to go bad, there's no point. That's okay, buy frozen, and it has just the right amount of vitamins as well. So I think with this, it's really just planning and knowing your behaviors, knowing yourself, knowing your habits, and that will really come a long way with saving money.
Thank you, Judith. Anyone else?
Well, I think getting back to, what we're talking about establishing new habits, when before COVID, a lot of the families who are food insecure, that didn't mean that there wasn't a lot of working going on in that household. Like there were maybe somebody had 2 or 3 jobs trying to piece together to, make ends meet. And if they've lost their job again, or jobs, then, again, that reorientation to the usual, because for a lot of people, the usual is let's get something really fast because there's no time to prepare. So I think it's great that Judith is a resource in our community to help people learn those new habits, because like you said, so many people, if you're food insecure, you may not have access to some of the tools like, do you have cable? I don't even know, so can you get on YouTube? Are you able to afford, your internet access? Or do you have a laptop at the house so then you can get on YouTube? But highlighting some of these activities that Judith and others of us who have these programs in our community so that people can learn these habits. I feel like, I won't, put out there how old I am, but I feel like there are some generations that women, because we've been working, we have been depending on other things for convenience. And so there's some families that there was no cooking going on. So maybe they didn't have the tools to cook. They didn't have, like you said, the knowledge to how to put together and plan a meal. So, I mean, we really need to be able to resource the community in that way to help folks build on those foundational skills. If you've got time, or, if you got time and you want to feed your family, then of course you're going to try to, find the things that are economical. There's certainly ways to do that. Farmers market, buy frozen, eat in season. But I think, again, because so many people, COVID just shook the bedrock of so many people's lives in so many different ways. I just think we need to, make sure and understand that there's some people who are still going to be rattled by the fact that they just don't yet know how to pull all that together, how to pull all that off. So it's wonderful that we have Judith as a resource to be able to point people towards to help them learn those skills.
Yeah.
I will say some of the things that I recommend to patients is, one, if you're drinking your calories, stop. That's money that can be better used on actual things that you can eat. For folks who do eat meat, we don't need to eat meat every day. We often eat more meat than we need. And so having a meatless Monday is an easy way to save money, but it's also healthy for you as well. Going canned or frozen over fresh is a really good idea. If you're going to do canned, go for no salt added. There's a difference, if you're getting canned fruits, you want to look for no sugar added. Everybody thinks it's just regular, but there's a lot of sugar or salt in those things. And you can, get the deals when they're coming, keep the coupons and have that stuff stored up. If you are working again, and you're on those schedules like many mothers are and fathers, our children, we are in a generation now of children who are not as adept with home skills as I would say we were. And I'm probably giving my age a little bit here too. When we talk about reorienting, this is a great time. Middle schoolers and high schoolers can learn to cook. Are we teaching them these skills? Are we making them responsible? If they are at home all day, are we showing them how to do these things? Are we showing them how to do grilled cheese or things like that? Cheese is great. It's a good thing to eat. peanut butter and jelly sandwiches. That peanut butter is a good protein, but are we empowering our children in this new normal with skills that they're going to need going forward? And so those are the things I encourage them to do. I think younger mothers feel this intense need to do it all. And if you're not doing it all for everyone, you're not doing it right. But we were raised cooking and cleaning, and we did just fine. We can put our children to work with us as well.
I agree. I agree. I know that at Contegra Parks, I'm putting on my community resource hat now. We have a lot of patients that come in that are, they lost their job, and an outlet that I do send a resource is like the food pantries. We have the crisis assistant ministry and the bountiful food ministry. They offer, bounds and bounds of food canned goods, meats, and all that. Also, we also have a program at Contegra where if someone is receiving EBT, they can called Super Snap. They can go to Food Line and buy fresh fruits and vegetables for $40. You get a $40. You have $40 to spend to buy fresh fruits and vegetables. They can be canned, but they cannot have salts or oils in it. You can get frozen. So that's also given, an opportunity for our patients as well as, others, if need be, a good place to go to get a good source of food. Also, I want to piggyback on FNAP. I had used to have, when we was getting together, I used to have classes. And I learned a whole lot. And a lot of the patients, they learned a whole lot. They used those recipes. They, instead of using hamburger meat, they chose turkey meat or chicken. FNAP is a good resource to help people to know how to cook, how to budget, and to get healthy meals. And even the patients, they also brought their kids so that way they can be taught. So hats off to FNAP. I like that.
Thank you. And I will put on my community resource hat on as well. So I will share my contact information if anyone is interested in participating in an FNAP class. It is a 6-week course, but like Elveria said, we learn about food safety, we learn about planning, budgeting, all the nutrients that come in our foods. And once you graduate, you do receive a cookbook and other materials that can help you prepare healthy meals in the kitchen. So
I love that. Yes, please put all of your contact information in the chat, all of you guys, matter of fact, so we can make sure everyone is able to actually see it. So, but yes, I agree. All of what you guys said are really great, easy solutions to kind of combat this issue that we're dealing with in the county. It's going to take all of us to, kind of put in that work to assist everybody across the board to make sure that they have what they need. And I just love the fact that you guys are so involved in that. Elveria and Judith, you guys are doing such a great job with that. Awesome. So our next question is more of a two-parter. So it says, throughout the pandemic, we were forced to adapt to a socially distanced virtual environment. Anywhere from office meetings to family gatherings to this Zoom call, we were all mandated to stay home and utilize the virtual space versus our normal face-to-face interactions. For several individuals, the lack of social interaction significantly impacted their mental wellness and led to an increase in mental health crises over the past year. So the two-parter question states, number one, can you speak to the importance in managing your mental wellness during a pandemic? And then two, what are some easy everyday solutions you would recommend for someone who suffers from the lack of social interaction required during a pandemic? And the way that I want to kind of formulate this question is I want all of you guys to kind of speak to it, but in your respective areas. We know that, of course, mental wellness is a huge deal no matter where you work or who you encounter. But what are some tips you've learned yourself if you are not necessarily working with a client where you're providing these resources, and what are some things that maybe you found to work for you? I know that all of us, especially in the roles that we have, most of where we thrive, I'm going to just make the assumption for all of us, is that we're interacting within the community, right? And so what are some things that you found to be really beneficial to kind of help you through this? And then, of course, the importance in managing it during a pandemic. So I'll open this up to everyone.
So I'd love to start. Talking to patients over the past year, we had increased rates of depression and anxiety. That's at all ages. We had increased rates of suicide attempts because of the isolation. For folks who had anxiety, it was like, well, if you didn't have anxiety, welcome to 2020, because that year was doing that. When I encourage patients who had a history of depression, this was the time it was going to come back because you were isolated. Reach out to your primary care doctor, reach out to your healthcare practitioner, reach out for help. If you're feeling stressed and you need an outlet, have a counselor. I have a wonderful counselor. She is fabulous, and I have needed her throughout this pandemic to be able to stay engaged and connected and really able to care for patients, even though people were sick and dying. I think we don't talk enough about having a counselor, how important it is to our mental health, how normal it is, and how important it is for us to stay our full and whole selves. And so it's okay to have somebody to talk to. My favorite is okay to have Jesus and a therapist. Both of those things are true. Jesus was the ultimate healer. He called us to do these things. So there's no reason that you have to say, well, my faith will heal me. That's not what God calls us to do. That is my personal soapbox. I do call us to interact with each other. I'll get back to the vaccine. When you vaccinate, you can get together with folks. You can go to church, you can go commune, you can go do things. However, previously, before the vaccine, I was meeting with my friends via Zoom. So we couldn't have drinks in person. We had drinks via Zoom. We did a Zoom painting class where we did color by numbers terribly together. We did these things. We even played virtual online games. So find a way to do that. Make sure you're calling or talking to someone every day, interacting every day when you can, and make sure that you're having physical interaction when you can. Hugging your children, they say just 20 seconds of an embrace helps, release serotonin, helps improve your mood. Hugging your dog, if that's what you have, but someone in the home, having that physical interaction if possible. And then if that isn't working, always reach out to someone you trust. Make sure somebody knows you are not okay. And it is okay to not be okay after the year we have had.
Amen. Amen.
Dr. Bowe is so correct. I was worried, again, for the populations that we work with, my coaches and I sat down and said, y'all reach out to these folks who we know who are known to have depression. I said, let's go ahead and let's be proactive, because everybody, is potentially, at risk at this point. But for the folks we actually know have formal diagnoses, we just don't need to wait on that. So that was one of the things that we did. But, I don't know, like I said, 2020 was also a year of, I hope for me, it's been deep reflection, like on the importance of relationships. I think we've, for many moons taken it for granted because there were so many ways we could interact or choose not to. But like what you were saying, it's so important. I mean, when you have lunch with your coworkers, because that's just the norm, that's the culture in the office, and all of a sudden you can't. I know here in the building where we work, we did all kinds of things to improve safety so that people could stay together. But sometimes people buck that. It was hard for, leaders to understand that. And we're like, well, if you have to stay in your space, 8 hours when you're used to walking around and talking to people, but now, you're so confined, people are going to want to go outside and sit at the picnic table, and it may be closer than what's recommended. But if they're being safe, please let them do it, because we still need that connection. For some people, the connection at work was the only connection they had because they lived alone. Maybe they didn't have a church circle. So, I think the recognition of how important connection is, and Dr. Bowe's words about it is okay to have Jesus and a counselor is real. For many communities, I know from the community from which I come from, Black folks don't want to have any struggles that require us seeking mental health, formal mental health help. We think it's sufficient to go to your preacher, but he may not be, or she may not be equipped to deal with what's really going on and help you develop the tools and the competency. So, that's real. We have to, make that normal. And I hope moving forward that this has allowed us to normalize the conversation about it. And so that people will be less resistant to, when that help is extended to them or suggested for them. And then just the basic stuff. I mean, I told you I'm a cyclist, right? I leaned in. My friends, I have leaned in like nobody's business, because physical activity increases, all of those good hormone levels to make you feel better, to make you feel more centered, and make you just feel more like yourself. So plus you're outside, you get the sunlight, and actually, being outside was really legally at one point the only thing you could really do at a distance and be around people. So I felt doubly privileged that I could see a few friends, before we, peeled out of our meeting spots. But it's so important that we take care of ourselves, and we deserve that. I think people need to hear that it's okay not to be okay, but we deserve to use whatever tool it takes to get back to being okay. Y'all got me on my soapbox. I'm a hush.
Don't feel bad. I agree, because I think even what you're saying, just the fact of what Dr. Bowe said about being that young, sometimes that first time mother, that young mother that wants to do it all right, wants to get it all together. And then sometimes you're failing to think about yourself. You're failing to think, well, in order for me to pour from this cup, it has to be full. It can't be empty. And that's one of my absolute favorite quotes I tell to a lot of my friends, and not to myself sometimes too. I have to be like, you can't pour from an empty cup. So if you feel like you're being depleted, if you feel like something is kind of just throwing you off, like Lisa said, you're not centered, then do whatever it is, whenever you have to, for however long. And I think that's something I'll say for me growing up, with a single African-American mother, kind of going through what we had to deal with and all of what comes with, having that in your life, that there are times when that single mother has never, ever thought about herself. She's never, ever shown you what it's like to take time to do something for herself, to buy for herself. So I feel like that was something I had to learn myself, even having my own children, like, hey, Krystle, sometimes it's okay to be like, you know what, baby, I know you want me to do this extra little activity. We can play Play-Doh in 5 minutes, but these 5 are for mama. And I need to take this, because if not, the Play-Doh session isn't going to go right. Okay. You know what I mean? So I think that's important. I'm so glad you guys said that, because giving yourself the permission to say that, you know what, I can't right now. And even being able to say that, I think that was another thing for me too, because a lot of us, especially as Black women and women of color, we think that's a sign of weakness to say, I need a minute. It's like, no, you're supposed to be able to have all the minutes in the world to do every single thing that your family needs, you need, your kids needs, your job needs. And then on top of that, that little ounce of something, figure it out. And then we know what that turns into. You know what I mean? So I totally agree. Judith or Elveria, did you guys want to speak to that as well?
Yes, I agree 100%. I always tell myself and my other colleagues, it's okay to have some me time. It is. When my kids was young, of course, I worked with kids before I transitioned to this new position. I said, mommy's gonna be in 15-minute timeout. They knew 15 minutes. Don't ask me for nothing. Don't say mama, because mama need her 15 minutes timeout so she can get herself together. They know I even had a little, you know, that little time thing. Set it. I shut my door. Before I did, when I got home, I made sure they had everything. Then I went in there. I said 15 minutes. They knew. Now they tell me because they adults, semi-adults. They're like, every time we wanted to ask you something, we couldn't because you know we had to wait for that 15 minutes. I said, that's right. Mama need her 15-minute timeout. And I do agree. I do agree to all that. I also want to add, like, since I live in the community and plus, well, there's work in the community. So when I do see, community members or, people out there in the neighborhood, I stand for my porch. I know this is real country. I holler across the street and I say, hey, y'all doing? I mean, and that's that connection that I would have. And then it's my next door neighbor, she's like in her 90s. So I would go to her house, knock on her door, and then step off her porch. It's like, hey, how you doing? I just want to check on you. She said, I'm so glad you came and checked on me. She said, I missed you. I said, I miss you too. So, just walking around the neighborhood, just, making sure everybody is okay, But yeah, I agree with all that. Yes, yes.
I love that. I love the fact that you even have that walking group. And that they're doing it on their own, like they're going to their own neighborhoods and still kind of keeping it going. So it's like you planted that seed in them to let them know, hey, we have to keep going with this. And you know what, just like Lisa said, those healthy hormones that are released, those endorphins that you're feeling, they're probably like, we need some of that. We got to do it, whether we do it on our own or with Elveria, we've got to keep it up. So I commend you for planting that seed in them. Judith, did you want to say something?
Yes, I agree 100% with everything that's being said right now. I think the phrase that I agree with the most is it's okay not to be okay. It's okay to feel those emotions. It's okay to feel whatever you have going on. And I understand that sometimes when we have the weight of the world on our shoulders, all we think of is, why is this happening to me? Why me? Why is this going on? But it's also important to realize, what is this teaching me? What am I learning from this? So feel those emotions, but know that this could be a teaching moment as well.
I was going to say the one thing I'd add to this is it's okay to not be okay. And it's okay to show our children this. Because if we don't model for them how to handle stress, if we're always pretending we're okay and being strong and pretending we're together, they don't learn how to handle stress. And so if you want to help your children know what to do as adults, you have to show them, I'm not okay today. I'm upset about the pandemic or this or that. And I just want to take 5 minutes. We have to model for them how to handle this. I think, and I love my mother was perfection. If we pretend we're perfect all the time, they do not learn to handle adversity as adults.
Amen. Amen. I have actually seen that as being something that I know for sure. I mean, I knew kind of coming into motherhood just 5 years ago that I was like, I absolutely want to make sure that I'm doing everything right. But just like you guys have all said, it's one of those things where you don't want, what is it, the saying, you do not want perfectionism to be like the enemy of what you're attempting to do, right? Because then it robs you of everything you're attempting to actually accomplish if you're trying to be perfect and do everything the right way. And giving yourself, again, that space to be like, you know what? This isn't it. I need a break. I need a shift, whatever I need to do. So thank you for that. So the only other question I have, and this is just something personally that I want to know from each and every one of you. What have you found after this pandemic and dealing with COVID and kind of all, again, the obstacles, the barriers, the things that we've all discussed? What do you think has been the number one most positive, I would say, lesson out of it as far as what you've learned with taking care of yourself and putting self-care, implementing it into not only your work, your actual profession, but making sure that you're that catalyst like Elveria and making sure everyone else within your community and your family and your friends are keeping up with everything with themselves. So I'll propose that question for everyone.
I think I would like to go first on this one. You know, role modeling is, like you said, is so very important. And, you know, I'm no different than anybody else here who not necessarily was on a conscious level striving for perfection, but was working really hard at taking care of a lot of different things for a lot of different people. And so again, you know, COVID and the pandemic really, again, put a halt to all of that. So you can't connect. I couldn't be trying to feed folk at the church. I couldn't be, you know, I couldn't be so busy distracting myself that I couldn't focus on myself. So all of a sudden, it really 2020 was a time to reflect. What was I neglecting with myself, you know, and really how what was I really teaching people, like you said, through the living. So it's okay to tell people you should be taking care of yourself. When's the last time I've been to my primary care? You know, it's okay to tell folks that you need to take me time. When's the last time I did something for myself? You know, when's the last time I told somebody no when there was something I really was not interested in doing and really had planned to just do something for myself, but I put somebody else before me. Um, so it really has helped give me the space and permission to put myself on my own list. And I'm so grateful for that. I mean, you know, there's been a lot of loss, you know, lost time with family, lost time with friends. But I have really, really enjoyed spending 2020 with myself and learning more about myself. So that's it.
Yeah, I think this year was the time that I learned the most about self-care because, like Lisa, I told everyone, take time for yourself, do this for yourself, make sure you spend time with this person. But I never did that for myself. So this year, I think was the year that I learned the most about self-care, and I actually practice self-care. And another thing that I'm very grateful for is my family's health. I didn't think about that often before the pandemic, and it's all I thought about throughout 2020. So I'm very grateful that my family is healthy.
Awesome. Thank you so much. All right, Elveria, you're next.
Well, during this pandemic, I agree with you, Miss Lisa. I agree 100%. I feel like it was a reflection. It was a time to reflect on me, you know, being so busy, not taking time out for yourself. And then you know, first, you know, I was an empty nester because my baby went to college. So that was a big adjustment because I'm like, okay, now what do I do? You know, but in the midst of that, I learned to just take time for me. I like my quiet moments, sitting in the house, doing what I want to do. This is my child calling me now. I have to hang up on him. But yeah, of course, doing Zoom meetings with her, you know. But yeah, that said, it was a reflection for me.
Awesome. It's kind of full circle now, right? We just talked about being everything to everybody, and here we go. Got the child calling in. Oh my goodness. But no, you guys are absolutely right. And I meant to say too, I love the fact that you talked about being distracted, Lisa. That's something that we've been so distracted this entire time where we haven't been able to really focus on ourselves because of that. And so it is time to kind of start, you know, shifting that focus and putting us, like you said, on our list. Because I swear we have daily lists, but somehow we just keep going further and further down that list. Dr. Krystle White, last but not least.
I learned that less is more. Because when this pandemic happened, I did not realize how overscheduled my life and my child's life was. You know, one day was karate, one day was piano, one day was ballet. We were just running, and it was these things. This aim for perfectionism. Well, I have to have her in all these things. I have to do all these things. And when it all had to stop, or we found a way to do it from home, we were slower, we were better for it We had more quality time. And so I learned to appreciate quality over quantity. We were sitting, we were cooking together. We weren't running to and from lessons. We spent days just at home together, and I didn't feel like I was depriving her because I hadn't taken her to the zoo or the museum or anything like that. It was okay to just sit and be with her. And I think we were both better off for it. And when we talk about what I've learned, when we go back, one, I'm going to be better about saying no. I can't do that. Or I'm going to do it on my terms when I can do it, that I am a priority and my children are a priority. And I'm not saying that anymore like, oh gosh, like it's keeping me up at night. It's no, the world stopped and ended and everybody was okay. So we can keep this up. I think sometimes I used to think, if I don't do it, the world is going to end. Well, the world ended and we all did fine. And so I've really learned it's okay to just really slow down. I am going to try my best that my daughter and I never return to that schedule. I think it's just not necessary. I know there's that push. I mean, I've already gotten one into college. I know we feel like we have them in those activities to get them ready. I don't want to do that for my daughter. I want her to have more of that slow time like I did when I was younger. And I'm really going to try and prioritize that. I hope that many of us can do that with our children. That lower level of stress for us is also a lower level of stress for our children. And it's nice.
It absolutely is. I'm so glad that you spoke to that because that was something I recognized that I was missing myself. You know, again, you're thinking, I have to do this, I have to do that, I have to have my kid involved in so much. And then you start turning around and it's like the travel time alone to get to and fro was like literally, you know, time. And like you said, that you could take cooking together. Now I don't have to rush to try to get the ingredients done or try to have to do crock pot meals for an entire month, which is still a good idea, guys. That's still an easy, quick, you know, inexpensive way to make things stretch as far as meals are concerned. But it was like I didn't have to plan within my lunch to actually try to do some of the things when I should be focusing on myself. And so I have to be honest, her not being in daycare has been quite stressful, you know, the virtual mom and learning and everything. But it was also refreshing because, like you just spoke to, those moments we could fill them in with doing what we wanted to do, not what we had to actually do. So I totally agree. Those are some great lessons. So I have really enjoyed our session this evening, ladies. I thank you so very much for taking, again, time out of your busy, busy, busy schedules to join us and to have this discussion around implementing self-care during a pandemic. Because again, like we've talked about, COVID has flipped our world upside down, and now we have to learn how to adjust. I mean, literally, this is the form of adjustment on Zoom alone. This is the greatest example, right? But outside of our, you know, our jobs and ways that we're adjusting professionally, we have to make sure that we're also adjusting personally, and not just for our families, but for ourselves, and making sure that we're putting, again, like Lisa said, I'm gonna say that again, on your list. So again, thank you so much, ladies, and everyone else who has joined us today. Again, we are going to continue to have these installments of these town halls every month. So look out for some information for our next one in May. For Mental Health Awareness Month, we're looking to actually try to focus on extending this conversation that all of these lovely ladies started about, you know, making sure you're managing your mental wellness, making sure that you're finding quick, easy, creative ways to get to your centered place, to get to your peace. Whatever we need to do to get to our peace, we're going to make sure that we have all those tools to make sure you have them. So again, thank you so much for joining us and have a great evening. Bye.